What is diabetes mellitus? Diabetes mellitus is a heterogeneous disorder, is the most common disease of the endocrine pancreas. Affecting 9% of the world's adult population in 2014, the prevalence of diabetes continues to increase worldwide, having already more than doubled over the past 3 decades. There are 3 types of diabetes mellitus. Type 1, characterized by destruction of the pancreatic beta cells, which produce insulin. This usually leads to absolute insulin deficiency. Forms of DM type 1. A. Immune-mediated DM, results from an autoimmune destruction of the beta cells. It typically starts in children or young adults who are slim, but it can arise in adults of any age. B. Idiopathic type 1 DM, refers to rare forms of the disease that have no known cause. Type 2 diabetes mellitus usually arises because of insulin resistance, in which the body fails to use insulin properly. The complications of diabetes mellitus type 1 and type 2: increased thirst, frequent urination, bedwetting in children who previously didn't wet the bed during the night, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, blurred vision. Type 3 diabetes is a title that has been proposed for Alzheimer's disease, which results from resistance to insulin in the brain. It is not yet a medical term or a recognized condition, but is a term now used in research looking into the causes of Alzheimer's disease. In type 3 diabetes, the brain cells, called neurons, become starved of glucose, which in turn can lead to a progressive reduction in memory, reasoning, judgment, and insight that characterizes Alzheimer's disease. At risk: people that have insulin resistance, in particular those with type 2 diabetes, have a 50% to 65% increased risk of suffering from Alzheimer's disease. Furthermore, research has found deposits of amyloid beta protein in the pancreas of people with type 2 diabetes. A similar protein has been found to deposit in the brain tissue of people with Alzheimer's disease. While Alzheimer's disease does also develop without having high blood glucose levels, having type 2 diabetes appears to accelerate the progression of Alzheimer's. Risk factors: genetic, age, family history, lifestyle, race and ethnicity. The major components of the treatment of diabetes are diet and exercise, oral hypoglycemia therapy, insulin therapy. Dietary considerations: